I will like to thank the organizers for giving us an opportunity to be here. I will just briefly introduce Dr. Sawhney, who is the chairman of my department in Gangaram Hospital. Two words about him I would mention to the August gathering here. He is a clinician par excellence and his work on lipids is phenomenal. But the biggest contribution possibly has been to the concept of group practice which he has brought up. The Department of Cardiology, the earning from the Department of Cardiology is shared by all the consultants. We work as one team rather than in groups, and it has eliminated lot of unhealthy competition just by his guidance. The second contribution of Dr. Sawhney has been he has established a Department of Preventive Cardiology in Gangaram Hospital. No institution has a separate department of preventive cardiology which he heads, and it is instrumental in giving advice to all patients of acute coronary syndromes, of chronic coronary heart disease, of heart failure, and has established itself as one of the leading centers in the country. Dr. Sawhney.
Thank you, Dr. Passey, for kind words. Respected Chairperson, good afternoon, dear friends. The lack of time, I think I will go straightway to the talk. Role of nutrition and nutraceutical in prevention of cardiovascular disease. We know that the most important risk factor for cardiovascular disease is lipid disorder. Dietary contribution is only 20%. Majority is synthesized by liver, and it is genetically determined. And simplified language, what we learn now that for the formation of atheroma, the LDL or non-HDL, which includes the remnant cholesterol, they are pushed into the atheroma formation. Who pushes is the blood pressure, diabetes, smoking, stress, and other risk factors. So that is the basic thing. We have learned from the clinical trials, of randomized clinical trials of 5 years for primary and secondary prevention, the prospective study of more than 12 years, and Mendelian genetic studies of more than 50 years, that if you reduce LDL cholesterol down below after 20 to 30, there is a reduction of cardiovascular event. But what we learned was very interesting thing, that the randomized trials are only for 5 years. On average, we reduce LDL by 80 milligram by statin, and the event reduction is only 30%. But look at the Mendelian genetic studies, where patient, instead of having 120 average LDL, they are having 80 milligram because of genetic predisposition, and this is lifelong reduction of LDL, which results in 80% reduction of cardiovascular events. So that shows earlier the better. If it is better to reduce LDL cholesterol as early as possible, so the lifelong risk is less, and we can live longer, we can have delayed coronary artery disease to reduce the lifetime risk. So with this concept coming to that the food which is causing atherosclerosis is animal fat. We know that meat products, egg and dairy is only animal product because the animals have liver that manufactures plant kingdom do not have liver, so no plant kingdom will have LDL cholesterol. This is the guidelines which came that remove cholesterol as an offending agent from the diet. That is for general public, not for the patients suffering from cardiovascular disease. Unfortunately, it was misinterpreted. People stopped statin, which was wrong. So as I said, plant products have no LDL cholesterol. Saturated products, less than 10% of calories is been permissible, approximately 7%. MUFA and PUFA, I think because of lack of time, I'm not going into the more detail of that, but sodium has been already discussed. So I will go straightway to the pure study. That is the prospective urban-rural study, which was done in 1,35,000 population in 18 countries from India. 35,000 patients were given, and this shows a new concept that high carbohydrate diet, above 60 to 70% consumption of calories from the diet, has causing more mortality than permissible saturated fat, and monounsaturated and polyunsaturated fat do not cause much mortality. So you can see this graph clearly shown. Total mortality in the upper part, lower part shows the energy from the fat, saturated fat, monounsaturated fat, PUFA, and the extreme right is the carbohydrate. You can see here, high intake of carbohydrates straightway increases cardiovascular mortality, also increases cardiovascular disease. So to simplify, in what we say, sugar is more dangerous than saturated fat. So why it is so? Because if you consume a modest quantity of ghee, butter, or non-vegetarian, particularly even mutton, which we'll discuss, the LDL cholesterol will go up, so also the HDL cholesterol. The ratio between the two remains same. and the LDL is large in size, it does not enter into the atheroma very easily. But if you take sugar, large quantity of carbohydrate food, sweetened sugar beverages as discussed, you increase triglyceride, HDL goes down, LDL are not changed because vegetarian diet do not have LDL. So the size of the LDL becomes low, the ratio between LDL and HDL changes, size becomes low, it enters into the atheroma formation. So sugar is much more dangerous in causing atherosclerosis compared to a modest quantity of saturated fat, what we have been doing other way around. Zero oil hypothesis is absurd. So what we learned that dietary cholesterol restriction is definitely important for patients for CAD, diabetes or high cholesterol like familial hypocholesterolemia. So please do not stop statin, thinking that for general public they say since only 20% come from the diet, so for general public unnecessarily restricting cholesterol diet may not be a good idea. But for patients suffering from cardiovascular disease, yes, we have to do that. Now other important thing which we learn from the nutrients habits is that the God and nature has made a very beautiful way of looking into that. What we will learn from that, if you have got high BP, high heart rate, sodium, potassium, sugar, fat, you sleep more, you exercise more, you have harmful effect on the health. If you do other way around, you do less of everything, again there is a harmful effect for them. So there is a sweet spot in between. Sodium around 135 to 140, sleeping 6 to 8 hours, modest exercise, heartbeat between 60 to 90. So this is what we are looking for. The modest quantity of intake of food is the best thing which nature has also confirmed. But there are three things which have got linear relation: the tobacco, pollution, and now we are learning LDL cholesterol. So this is a new concept which we learned. Dietary management, we know we are overeating and the foods have been already over. Kachori has become Raj Kachori, and someone has rightly said, 1/4 of the food what you eat keeps you alive, rest 3/4 of the food what you eat keeps your doctor alive. So this is a fact, and the food particles like soya is a good vegetarian protein. The trans fats are dangerous because of reusing of high heat oil. Vegetable fruits have been discussed already. Nuts are very good food for human being. They do not have any cholesterol and they are having appropriate MUFA, protein, minerals, fibers, everything. A handful of nuts are good. Dairy has been overrated as a very nutritious fruit. Probably doesn't look like that. We may be restricted. In pure study we found a small quantity of non-fat dairy probably may be good enough to be used because it has got casein, which causes lactose intolerance. So what I personally tell my patient, one should drink milk till you drink your mother's milk. After that, we have no right to drink others' milk. People, they have a lot of restriction for that. I always ask them, I have yet to see a horse drinking a cow's milk for calcium or bone health. Nobody has done so far. Ideal cooking, which we will discuss because lack of time, I've been told, so I will be discussing during question answer session. Yes, what thing I want to say is that the monounsaturated fatty acid PUFA is very good. The ratio has to be 1:1 up to 5:1 and it should be stable at room temperature. Comparison of oils, we'll be discussing more after in the question answer session. The canola oil, mustard oil, the linoleic acid and alpha linoleic acids, the ratio is 1, which is one of the best which we have seen. Olive oil, this also I will skip here because of the time. Olive oil just recently published that not for heating purpose but for sprinkling on salad in small quantity, as we saw in Mediterranean diet, has shown reduction of total mortality and also less carcinogenic. Healthy oil in India, we know we have to discuss about that ghee versus other oils, which we'll discuss later. I will keep my slides open. The other important area is the goat meat in India which we get versus the lamb which we get in other parts of the world. What is the difference between that? So goat meat is actually found to be lower in carriers. This is the leanest red meat. Total fat is less, saturated fat is less, cholesterol that not just the lamb, pork and beef, but also turkey and chicken meat. So this makes the goat meat the healthiest red meat, even better than turkey and chicken, because chickens are broiler, tasteless, then they are the artificial, where that mutton of the goat meat of India is a pure meat. It has a nutrition value which we discussed lower part, that is very nutritious compared to the lamb meat. The alcohol, little bad news for us that in India, now we learned that it is no more a U-shaped curve, it is a J-shaped curve. The teetotaler are equal to modest drinker. So complete abstinence is easier than perfect moderation. It is not possible, which was we have seen. Now coming to my second part of the talk is nutraceutical, how we can manage them in clinical practice. So there is a group of patients, what we have seen that those who need nutraceutical in clinical practice. These are the ones, those who are low risk population. We do see many young people coming to you in 30s and 20s with high cholesterol level. They have no family history of heart disease, they have no diabetes, no hypertension, no calcium score. All these things they need statin. Even if a young person comes with all this risk factor with familial hypercholesterolemia, they need statin. But there are many children, they come to you in clinical practice with executive checks. Their levels of LDL is 140, 150. They say we have done best possible diet control, exercise, yet our cholesterol is very high. How to manage them? Probably the answer at this point of time is nutraceutical. So the three types of nutraceutical, one is absorption inhibitors, second is synthesis inhibitors, and third is the increases the excretion. So I will discuss shortly. So in that what we have seen that this low risk group of population, probably those who have got mild to moderate dyslipidemia, but they are at low risk. They are not at risk of cardiovascular disease. Since we have learned that at young age we treat hypertension, at young age we treat the diabetes, why at a young age we are not treating LDL? What is the reason? And we know the strongest risk factor, which is a killer of human being, is LDL. And that starts much early in the life, going to the lifelong risk. So why not treat them? So for that reason, which we have now learned, the best absorption inhibitor can be used is the plant steroids. LDL synthesis inhibitor is available now, red yeast rice and garlic, and then berberine. These are all available to us now, not been studied in randomized clinical trial. They have been studied in small randomized clinical trial, but there is no outcome data at the moment available. Can be used in statin intolerance patient, but in young people, those who've got high cholesterol, I think this is the drug which should use. And finally, the fish oil, the last part of my talk, is this what we have seen that we have been using fish oil over the counter of no use to us. But the reduced study has shown that that fish oil has got two components, EPA and DHA. The EPA component is important. So in this study, they found 4 gram of EPA was given in high triglyceride patient with primary secondary coronary artery disease, and they found significant reduction of cardiovascular event by 25%. And this was in fact echoed by a Japanese study, but here instead of giving 4 gram of fish oil, they gave only 2 gram of fish oil in Japan because they take lot of fish. Their EPA level was already very high. So they showed similar results, 25% reduction of cardiovascular event. But then came the study called Strength, where they used fish oil which has EPA and DHA combined, and the study failed. So that shows that if at all we have to use fish oil, use only EPA. And this is what we have learned now, that these fish oil over the counter available are always have a combination of EPA and DHA, but not a right quantity. We have in India now Cosatil available to us, a little expensive, but that is available to us as an EPA. I think if at all we have to use for high triglyceride population, then we should use this EPA, Cosatil, not that. So I think I will stop my study talk here, and we'll go to the question answer session. And this is what a summary of that, what we should eat and what we should not eat. The whole grains, brown rice, as Dr. Ishii has already spoken to us in great detail about that, about the cooking oil, mustard oil, and ghee has been found to be good in moderation. And the trans fat we should avoid. Sweet and sugary beverages are bad. Excess salt is bad. Processed food, processed meat like the lamb is bad, not the goat is bad. Lamb is bad. Fast food, the salmon, the sausages and ham is not good. And the high caloric food is also not good. But dietary cholesterol and saturated fats are not be considered to be harmful in modest quantity for general public. You should remember that. We should not make a story of zero oil hypothesis or low cholesterol diet is not essential for human being. Thank you very much for your kind attention. Keep the slides.
Thank you. Thank you, Dr. Sawhney, for that wonderful talk. I think it's a very difficult talk, and to summarize it in half an hour needs really huge understanding of this space. Quick question, if I can. You mentioned two things which are contrary to what we believe. One was that goat red meat is better than chicken, and milk consumption is to be consumed only till you need the mother's milk. So is that a paradigm shift that we are seeing in terms of how you look at these two sources of protein and nutrients in our diet?
That's what the common notion. In fact, I discussed, I'm repeating it again, that the goat meat in India, which is there available, is the leanest red meat what we have. It is not the lamb, the sheep meat, which has got lamb is less than 2 years and above that is mutton. The goat meat in India is much inferior in terms of, I mean, inferior, I would say the other way around, that is superior in terms of the low cholesterol level. They have got high protein, they have got high iron, they have more nutrition value because they have more fat. The lamb and the mutton, they have more fat. So if you look at the chicken, it is a broiler, artificially raised in 2 weeks or 3 weeks to large size. There is some hormones have been given to them to raise that. It is not a pure meat, and it doesn't taste you well also, I can tell you sure. It is tastier, it is a pure meat, the goat meat. So if you look at the nutrition value, I always believe that the goat meat is maybe costly, but goat meat is superior in my view if you look into the purity and the nutrition value comparing with the broiler chicken. Now coming to the milk part, I think it was never our property. Nobody on the earth, no animals, nobody drinks others' milk. We take non-vegetarian food. This is also a type of non-vegetarian food which comes from animal kingdom. So pure study has clearly shown that a unsaturated milk, I mean you toned milk, and its preparation like lassi or yogurt and all things are good. Maybe you can make a kheer or something like that. But drinking a glass of milk in the morning and in the evening, giving to children in the morning to go with a milk glass and come back with another milk glass doesn't work well. This is not a good habit, and many people, they get allergies to milk because they get nasobronchial allergy. They get lactose intolerance. So I don't think milk is a good property which we should use it just like eating a non-vegetarian food. A small quantity of that can be used. So in my personal view, I don't think it is essential for calcium. 2 liters of milk drinking to give a calcium. If you do not have vitamin D, that calcium goes into urine becomes expensive. That's all.
Right.
So can we proceed to the panel discussion?
Yes.
Thank you very much, sir, for your wonderful lecture, and you have very well summarized in your talk. Thank you very much, sir.
So
With this, we end this session. Thank you, sir.
I would request Dr.